Great, thank you. And so just as we're kind of segueing from Nadia on the digital transformation side to Dina Shukam, who's going to be talking a bit about child welfare modernization on Salesforce, it's an area of focus that we've had. I mentioned earlier I've been at Salesforce for 9 years. Prior to that I was at Oracle. My mom for a period of time was a caseworker. And so there's a lot of folks in this room on the Salesforce side. Our DNA is around social services, family services, and child protection. And so we guard that very carefully and closely. We are very much involved at both the state level as well as the county level when it comes to child welfare. I know in the state of California, we are the child welfare system that's being rolled out currently right now throughout all the counties of the state of California. We're being utilized in Los Angeles County specifically as a separate type of child welfare in order to be able to enhance what they have. And of course, as you know, Los Angeles County is 10.2 million people, so it's a fairly large county. And so our focus has really been around how we can improve the quality of life of families and of children. And so the segment we're going to be talking about right now is how we're trying to accomplish that and how we can help the state of Hawaii get to that point as well and help modernize. So Dina, over to you.
Thank you, Bob. I am back. You thought you're done with me, but I'm back for round two. For those that I haven't met yet, I'll do a quick introduction. I'm Dina Shukam. Like Bob mentioned, I'm part of the digital transformation team at Salesforce. I'm specifically tied to the West in state and local and have been supporting state and local agencies for the past 7 years. Previous to Salesforce, I was at Gartner Consulting, so I was in an advisory consulting role for 5 years there. And I'll tell you, I love working with public sector. You know why? It's the mission, right? You all are in this to make a difference, to support individuals, provide resources, benefits, and that's very powerful, right? So I just want to take a second and thank all of you here in the room for your dedication to public sector, for all the impact that you've had on your communities, and for the time and all the hard work you put in, especially over the past couple of years. So thank you all, public servants. So to start, when I joined Salesforce, like I said, I came from Gartner. I thought of Salesforce as a CRM solution, right? Similar to Nadia. And then when I joined Salesforce, I realized, wow, this platform is quite powerful. We can actually do quite a bit across state and local, whether that's health and human services, transportation, DMV, public safety, and over the years actually invested in solutions specific to public sector with dedicated data models, built-in capabilities, so you don't have to start from scratch when you're developing applications. So for today, I'd like to focus more on health and human services because I'll tell you, one of the top questions I get is, what does Salesforce do for government? Right? What do you do? We thought you're just a CRM provider. What do you do for government? So today we'll focus on health and human services and child welfare specifically. You already know who I am, so I'll skip this one. As you can see on this map, we have 44 states and Washington, D.C. leveraging Salesforce today to modernize their health and human services programs in some way, shape, or form. Right? This includes many different programs, as you can see on the right side, including integrated eligibility. We have some states leveraging Salesforce for their child welfare solution modernization, whether that's a full case management modernization or bits and pieces of the child welfare program. We have other states leveraging Salesforce for child support, child protective services, adult protective services, and many others. Right? And of course, over the past couple of years, the platform has been able to support states in contact tracing and vaccine management as well. And so these use cases across these programs can vary quite a bit. Right? I already mentioned case management as an example. There's other examples, including engagement with citizens and providers through outreach capabilities, contact center operations, licensing of providers or foster facilities, and then, like I said, COVID response over the years. And so as an example, we have state of Colorado. Over the past couple of years, they've made a decision to take a cloud-first approach. Very ambitious, right? And they have leveraged Salesforce over the years to modernize over 90 applications onto the platform, 15 of which are within the health and human services programs. In addition to that, we have state of Virginia. They also have adopted Salesforce as their enterprise platform for the whole state. Right? And so now they're in the midst of modernizing some large systems throughout the state of Virginia, starting with integrated eligibility, child support, followed by child welfare. And so in child welfare specifically, we have 11 states in total who are modernizing on Salesforce in some way, shape, or form. Some, like I said, are taking a full modernization effort. replacing everything they have within child welfare, full CWIS replacement. Others are taking more of a modular approach, so they're taking bits and pieces at the pie, right? And then some others say, you know what, we just need a foster recruiting and onboarding portal. How can we do that, right? So there's many different ways that we can tackle that. And so overall, when we're talking about child welfare, we're talking about children's lives at stake here, right? Based on the latest child welfare outcomes report back in 2019, that's the latest one, we have 16% of children today who are under the age of 18 that are estimated to be living in poverty, while 424,000 children are in foster care. We also have in total 656 children who are confirmed to be victims of maltreatment. The top type of maltreatment today is neglect, followed by abuse. Right? That's 80% of reported cases are neglect. And we also have child fatalities on the increase, 12% increase between 2015 and 2019. So the role of child welfare agencies is more critical than ever before, right? And this is pre-pandemic, right, these numbers. So we're now all waiting for the reports for the past couple of years. So this is your opportunity to step up, not only to protect these children, but also provide them the opportunity to thrive in life, provide them an opportunity to be able to achieve the goals that they have and objectives as a human. Provide them stable living conditions, right? And be able to strengthen their families by providing them the right benefits, the right resources to keep the family unit together. So when we're talking about child welfare agencies, there's 3 core strategic objectives, right? First, keep the children safe. That starts by protecting them from abuse and neglect, also preventing and responding to any maltreatment that's reported, and then strengthening the family unit to prevent any future abuse or neglect. The second objective is permanency. Every child needs to have a home to go to and a family to go to at the end of the day. Stabilizing those living conditions to preserve the family unit, and then of course there's a difference between abuse and neglect here, right? And we're seeing a growing rate of reported neglect that's due to poverty. And so now states are in the position of really asking themselves, well, if it's due to poverty, then what do we do? How do we approach those specific cases? And instead of taking the child away from their family and placing them in a foster home, you actually provide more resources and benefits to that family to put them in a position to be able to better support their children. And the last piece is ensuring their well-being. Make sure the family has access to resources to meet the needs of their children, whether that's physical needs, mental needs, and educational needs. So now state agencies have taken different approaches to be able to modernize and be able to meet these objectives, right? And it's definitely not a one-size-fits-all. I like to say, as we mentioned before, it's incremental, right? That's kind of the hot topic of the day. But it's really, the important part here is to be able to protect the children and be able to provide them the right resources they're in need of. So the near-term need that we've seen over the past couple of years is ensure the safety of the children. Right? This can be supported by standing up a reporter portal. Say that 3 times and then we'll be good. So the case for this portal is really to provide teachers or trained professionals throughout a state one place to go. So if they see any abuse or neglect, they have that one portal to go to be able to report it. And then others are investing in foster parent portals to be able to respond to emergencies when they come up, be able to communicate back and forth with the foster families throughout the state, and also be able to communicate with the youth. And then in the midterm, we have the question usually is around how do we make our processes more efficient? And again, another hot topic of the day, right? And so the easy way to do that, typically, we lean on self-service. Enable and empower your families, your teachers, your community to be able to access information on their own, know what benefits they're eligible for, right? And be able to self-serve and have access to that information through mobile capabilities. In addition to that, empower your workforce, right? So if you have investigators out in the field for reported abuse or neglect, provide them mobile capabilities to be able to capture information while they're out in the field on not having to come back to the office to be able to make updates. And of course, in the long term, the goal is sustainability, right? How do we make sure the changes, the investments that we're making today are sustainable in the long term? How do we make sure we're investing in the right solutions today that are flexible enough to be able to bend and flex and change as our needs continue to evolve? So many states are investing in that single source of truth. that one place to go to access information about that individual that is integrated with all your core systems throughout the state. Others are investing in real-time dashboards. We saw some analytics examples earlier to be able to gather and may actually make best use of the data that you already have in place. Gather it all and be able to see it in a visual perspective. So you can identify trends, be able to track outcomes over time, and actually be able to take more proactive measures in the future. And also the last piece is breaking down the silos, right? We heard about the legacy systems today, and then we talked about integration. Break down those silos that are in place today to enable that comprehensive view, again, of that child, of that family, to help you be able to better serve them in the long term. And so we at Salesforce have been so grateful over the past years to be able to support agencies in achieving each of these objectives and meeting them where they are, right? Because each state is very different. And so from a full CWIS replacement to modular targeted use case implementations, like I mentioned, there's 11 states in total that have leveraged Salesforce as their preferred platform. And I'll talk about a couple of states here and highlight them, but as you can see, there's quite a list of different areas of expertise or use cases that the platform can be leveraged for, but I'll highlight a few examples just to give you a bit more information. And so out of the 11 states, 5 are completing a full CWIS replacement on Salesforce. Starting with California, they are in the midst of implementing Salesforce for all 56 counties throughout the state. And this has been a journey, as you can imagine, and they are now in the midst of implementing Salesforce for all their counties. Then we have state of Indiana. They are modernizing today on child welfare, their full CWIS solution on Salesforce, including their child support enforcement capabilities as well. And they also stood up a portal for licensing for foster parents throughout the state. And they were able to stand up this portal, license over 6,200 foster parents throughout the state of Indiana. And then we have state of Delaware. They went live on Salesforce back in 2018. And they actually included not only full CWIS replacement, but also juvenile justice. And they implemented the solution in 22 months. That is pretty quick for a full CWIS replacement. And then, like I mentioned, other states are taking more of a step-by-step approach, right? A modular approach to modernizing. For example, the state of Louisiana, they went live with Salesforce back in 2018. They focused to begin with on a central intake portal. Like I mentioned before, a place to go to be able to intake any abuse or neglect cases, right? And then in addition to that, they also invested in mobile capabilities so their investigators can capture information in the field. And they also rolled out a program for their Child Protective Services program. And it's a mandated portal, again, for teachers and others to be able to report abuse. State of New Hampshire, they also started with intake, so you can kind of see a pattern here, right? Usually, a good starting point, I would say, is that front-facing piece, right? Facing the citizens, facing your providers, your foster parents, providing them a self-service capability and an experience up front that is very intuitive and very simple to follow. In addition to their intake, they also integrated with their existing legacy CWIS solution with a plan to be able to modernize it in the future as well. And then state of Michigan, they focus more on their Child Protective Services program. And they have invested in a mobile application for individuals to be able to report abuse. And now they are planning on taking on a journey to replace their full CWIS system as well. So some are taking a full CWIS replacement approach, others are taking a step-by-step approach, and some, like I said before, are taking just a very focused, I need a portal, and really just investing in that one piece, right? For example, state of Massachusetts, they focused on modernizing their foster recruiting and onboarding experience because they were having a big shortage in the state. State of New Jersey, they stood up a kinship program, right? So if there's a report of an abuse or a neglect, instead of taking the child away from the family and placing them in a foster home, their goal is to actually place them with an extended family member and provide that family member with the right resources and benefits they need to be able to support that child. So as you can see, like I said before, there's many different sizes, many different shapes to a child welfare modernization. And thanks to the flexibility of our platform and our capabilities within Salesforce, we meet our state partners where they are. Depending on their goals, depending on their objectives, we're able to provide those capabilities that they're in need of today that are also flexible enough to be able to build upon it in the future as well. So, the vision here, and I recently presented this slide to a state client of ours to really show what an ideal future state would look like. Taking a whole family approach to service delivery. From the moment they reach out to you or you reach out to them, to the moment you actually provide them a service or you connect with them, right? Managing their case and their relations and the services that they have access to, delivering the service, and then at the end of the day, be able to report on the outcomes and the metrics associated with your services. So no matter what their preferred communication channel is, be able to connect with them directly, right? And be able to support them every step of the way. Integrating across your program. So when we talk about full CWIS replacement, doesn't mean you replace everything that you have in your agency, right? It's about connecting with your core systems, providing a platform that can provide certain capabilities, but there are core systems that will continue to be there, right? You're not planning on replacing. So the goal is to connect with those core systems in order to enable this whole family approach. So I would like to just take a moment and encourage all of you to kind of take a step back, right? And as I mentioned before, put yourselves in the shoes of your constituents, your families, the children, the teachers. Say, what information do they need today? How can I improve their experience and make it easier for them to be able to report any abuse or neglect and provide the families, the foster families, the right resources, the right benefits that they're in need of. Thank you all so much.